This podcast is intended as healthcare practitioner education only and is not a substitute for medical advice, diagnosis, or treatment.
There's so many studies now which have actually shown that both COVID as well as the vaccines can actually cause thyroiditis. So they can cause subacute thyroiditis, which is not necessarily autoimmune, it's more inflammatory as a result of the effect of the spike protein.
I would say that over the whole COVID, COVID itself is such a major physiological stressor on the gland, but also that stress that impacted people across the board during those COVID years was crazy. We'd never been faced with this. There was lockdowns, there was loss of jobs, there was vaccines to deal with, there was virus. There's so many ways that cortisol and those downstream effects affected the gland.
So I came off the pill and then I got COVID. So I actually came off and I was it kind of sunk my body back to a normal period, between the 25, 35 days. And then once I got COVID a couple of months after, I actually didn't get a period till over 50 days. It was quite irregular in the months to follow.
This is Bioconcepts Between Clinical Minds, the podcast that's open-minded enough to take in all sides of a clinical story. You'll hear from researchers, doctors, naturopaths, nutritionists and patients. We look at common clinical presentations through a different lens. It's open, frank, and sometimes controversial. Nothing is off limits. Will it change the way you treat? We'll leave that up to you. In Season 3 of Bioconcepts Between Clinical Minds, we look at thyroid health. We talk to experts in the field who will take you into their clinics and share their experience. I'm Tony Chambers, and this is Bioconcepts Between Clinical Minds. In this episode of Between Clinical Minds, we continue the conversation, this time on post-COVID presentations of thyroiditis, with thyroid specialist naturopath Tara Nelson, integrative Dr Ameeta Gajjar, and a young hypothyroid patient. Many healthcare practitioners have noticed an increase in thyroid presentations post-COVID infection and vaccination. Integrative GP Dr Ameeta Gajjar says the increase has also been validated in the research world.
So initially it was my own observations. It was hard to say at first because, is it because of my interest in thyroid that I'm seeing more patients with Hashimoto's and thyroid disorders? But what's interesting, and this really made me do that research, and it's actually in the study. There's so many studies now which have actually shown that both COVID as well as the vaccines can actually cause thyroiditis. So they can cause subacute thyroiditis, which is not necessarily autoimmune, it's more inflammatory as a result of the effect of the spike protein. So subacute thyroiditis is quite common. It starts off with like a hyperthyroid, and then it generally, in most cases, in about 80% or so, it normalizes and people become euthyroid again, and then they're fine, like weeks and months later. But there are approximately up to maybe 20%, it's said, who end up being hypothyroid. So they never quite recover. So there's that initial hyperthyroid, overactive, and then the levels sort of come down in most people, but in some people they just continue to decline and become continue to have an underactive thyroid. So subacute thyroiditis has been very well documented from studies all over the world. There has been an increase in Hashimoto's as well, and also Graves'. So there's been quite a lot of case reports where people who were in remission from their Graves', it's got triggered again after COVID. Even after a year or even several years of being in remission, the COVID has definitely just triggered something. And there's also been new onset Graves as well.
And so is that the mechanism going on there? Is that just that the inflammatory aspect? Is that the driver?
That's one of the drivers. And basically the spike protein, it's the receptor for that is really the ACE2 receptor, so the angiotensin converting enzyme 2, which is very rich in the thyroid gland, but also in the testes, ovaries, hypothalamus, pituitary, adrenal glands, and pancreas. So because the thyroid gland is rich in that, so it just attracts, like a simple way of putting it, the spike protein. So that's the way the virus gains entry into the thyroid cells. So it's that, but also the systemic inflammation, the cytokines from that general COVID infection as well. There's some speculation as to whether, similar to other viruses, whether there could be a bit of molecular mimicry going on, but I've not read too much around that. But that could be a possible mechanism as well. But certainly the systemic inflammation and the spike proteins and the ACE2 receptor aspect is definitely the main methods.
Where are you kind of catching it when they come in by the time it's hypo, or where are you kind of seeing this?
I'm usually seeing it sort of much later. Maybe it could be months after their COVID infection. So that they're the hypothyroid. So again, it may have been picked up already on their blood test with another GP, or again, they're just feeling unwell and nothing's been found in the bloods. And then obviously we go into detail and find that they don't have optimal levels of thyroid, and the inflammatory markers might be up. So obviously with subacute thyroid, the Hashimoto's antibodies may not be there, but the inflammatory markers like the hsCRP and the ESR can be raised as well. So it's about tackling the inflammation and not just giving the thyroid hormone.
Given that this is kind of new, have you seen any patterns within your own patients as far as the type of patient who's more likely to be affected by thyroid dysfunction post-COVID?
So it is said in the studies that if someone has a thyroid condition, that doesn't necessarily predispose them to getting COVID, but if people already have thyroid dysfunction, they're unbalanced, they can be more likely to get it and have a more severe form and longer lasting. So I have seen that in practice. And again, I think it is still early days. But again, given how many patients probably do have unbalanced thyroid, even if they do know about it, that would explain why so many sort of suffer the symptoms. And of course, there's so many people who probably do have a thyroid condition with suboptimal hormones, don't know it, and they're hit quite badly with COVID as well.
And that's exactly what happened for Bianca, a young woman in her mid-20s with a family history of hypothyroidism. She developed the condition post-COVID infection.
So I came off the pill and then I got COVID. So I actually came off and I was getting, it kind of sunk my body back to a normal period, between the 25, 35 days. And then once I got COVID a couple of months after, I actually didn't get a period till over 50 days. It was quite irregular in the months to follow. It was quite irregular, which was quite odd. And I wasn't sure, if my body was just trying to readjust with coming off the pill and if this was normal or not. And I thought, I'll just leave it. It might be 6 to 12 months for my body to really understand what it is, not thinking that COVID could have actually complicated it or, actually disrupted my menstrual cycle. So I thought, I'll just leave it. And the months kind of went on. I didn't actually have a period for 3 months straight. So I think it was almost 90 days without a period, which was the most worrying and I guess triggering thing for me to really think, wow, what is going on here? I'm not pregnant. So what else could this be? And that was, I guess, a big scare and shock to the system when your body isn't doing something that we're told as women, that normally happens every month and should be happening. So that was, I guess, the turning point for me as a patient thinking, okay, I need to get some help here and I need to go to a doctor and there has to be I have to find out what is causing this because this isn't okay.
And so along with the stress and the anxiety, were you feeling any other symptoms?
I was quite bloated and uncomfortable and quite lethargic and just I guess, even didn't have the energy. I just felt exhausted in that period. And if it could have been even, my mood was a bit down, I guess, because, I think when your body or you're unwell or your body isn't functioning that how it's meant to be, there is something that, you're like, oh, what's wrong with me? Or why is my body not doing this? And they're kind of, I guess my mood and energy was quite low in that time, which isn't, someone like me, I'm quite energetic, quite active and sporty. And, to really feel like I had no motivation or anything to do anything was really, I guess, a worrying point for me. It was, how am I going to actually fix this? Am I ever going to get my period back? They were thoughts that were kind of, that I was having in that time.
And what happened when you went to see the doctor? What did they do?
So when I went and spoke to my doctor, she was, I guess, suggested straight away to get a blood test and kind of have a look and make sure, firstly, that I definitely wasn't pregnant. And, to also just check if there was anything in my bloods that was, alerting or could help explain what was going on. And also to get an ultrasound as well, and an internal one as well, to see if there was anything like PCOS or anything kind of happening with my ovaries as to why I wasn't having a period.
And what came back, particularly relating to your thyroid?
So previously I had a blood test, I think it was in 2019, and my TSH levels were 1.9. And then 2 years after I got tested, and my levels were actually at 4.1. So that was, I guess, the big sign for my doctor to say, okay, hold on, that isn't in the, I guess, ideal range. So that was a big, I guess, could point towards why, explain what was happening with my body at that time.
What did the doctor do when she got the results?
So she sat down with me and looked over the results, and she told me that I had subclinical hypothyroidism and so an underactive thyroid and even Hashimoto's disease. So it seemed that my thyroid, my body was attacking my thyroid, which was so interesting because I knew my mum actually had a thyroid issue, and I couldn't remember if it was hyper or hypo. So I was unsure, and so I quickly called my mum to be like, which one is yours? Do I have the same as you? Because I didn't realize that it can run in your family as well. So and then I found out that my mum does have an underactive thyroid as well. So and that, lucky me, she could probably pass it on to me as well. So,
And so how are you managing it now?
So the doctor popped me onto some thyroid medication. So thyroxine, I think at a lower dose, just the 50 every day. So it was funny, I came off the pill not to take medication and then I got given another pill to take every day. So I've been taking that every day and monitoring monitoring and getting every 3 to 6 months a blood test just to make sure that my levels are still, where they need to be, and if the medication actually is working or not working. So I have had a blood test, and it has now dropped back down into the ideal level, which is awesome to hear. And also, as soon as I was on the medication, I think it was only a few weeks later, my period came back, which was amazing, which is really the best thing, is you think, that you don't want your period and, it can be inconvenient, but it was the best relief. And it was just a wave of, it just flushed everything out, if that makes sense. And it was just wow, my body has been restored to a sense. And then I have also taken some supplements as well, like magnesium and to also help assist the thyroid. And things I've also done is I think in that time, because it was quite a stressful time, then you're eating worse. So I guess what I've been trying to really make sure is keeping that balance between, daily movement and exercise, a really good nutritious diet, making sure I have enough sleep, being consistent in taking my medication and supplements, because I find if I do start to lack in one area, then because of the hormones, then I find that my period starts coming a bit later. It's really, I guess I'm using my period as a report card, even with how I'm tracking. And I find, those stressful months, say if it's with work or I'm not having time to actually, do some meal prep, or I'm not making enough time to make sure I'm going out for a walk or something, then I really find that, yes, the medication definitely helps with that, but I find all those other factors help me to stay in that level of, making sure my period's coming within those 25, 35 days. Because I do find even on medication, I can still get over 40 days sometimes. So it's really in those months that, I find the medication's one part, but I do need to make sure that I'm doing all those other things to make sure that I still am doing for my body, make sure I am actually looking after my body and my health.
Tara Nelson is a specialist thyroid naturopath, and she says the impact of stress from the whole COVID experience on the thyroid cannot be overlooked.
I think that's the one that, I was just talking about before. It's almost like a bit of a low. So what we started to see from around 2020, and I'm still seeing to this day, but was much more, and we know that, high cortisol, inflammation can directly impact that HPT axis and affect that brain, the feedback loop in the brain regulation of those thyroid hormones and causing a low TSH. But we started to see that just across the board in a lot of my patients, online, in clinic, when in that COVID era. And so the virus can directly enter through those ACE2 receptors and another protein. It's got a big long name. I can't remember it. But there's two ways that it gets into the thyroid gland, and it can have so many impacts on that thyroid gland. It can decrease it destroys the thyrocytes. It mounts this huge inflammatory storm. So we'd see direct inflammation going on in the gland from that virus. It can cause altered immune responses and flare autoimmune conditions, or actually trigger Hashimoto's or Graves' disease. But we did see that main presentation of that low TSH, that virus actually affecting that HPT axis. But again, I would say that, over the whole COVID, the COVID itself is such a major physiological stressor on the gland, but also that stress that impacted people across the board during those COVID years was crazy. We'd never been faced with this. There was lockdowns, there was loss of jobs, there was vaccines to deal with, there was virus. There's so many ways that, cortisol and those downstream effects affected the gland. But I would say that was probably the biggest one. I'm seeing, and that inflammatory response is really, really important to take note of, because across the board we were seeing, high CRP as well, and elevated interleukin-6 and raised levels there. I'm actually treating a couple of cases at the moment of Graves' as being triggered by both COVID and the vaccine. So people were coming to see me. That's still happening. Long COVID presentations as well, particularly in postmenopausal women. These poor women just lost their estrogen and that antioxidant that estrogen has on them. They're older, they're probably a little bit more inflamed, and then they just keep getting COVID, and it's just this big rebound. So I've got a couple of postmenopausal women with long COVID, but it's been a very interesting time, and just the way that virus can affect thyroid function is super interesting.
Tara Nelson says regardless of the trigger for autoimmunity, her approach is the same.
I talk to my patients in my program about is that diet and lifestyle is huge, across the board. And, we definitely can talk about treatments that I bring in initially to really dampen down and modulate that immune system. But it comes down to, and this is the best advice for someone with Graves that has that flares. It's coming down to your diet and lifestyle and being really consistent. So diet would definitely get away from those very inflammatory type foods, the gluten, the dairy. If we look at, the AIP, the autoimmune paleo principles, diet is a quarter of it. So, really taking away foods that we know once get into the bloodstream, the immune system reacts to. So in autoimmunity, the immune system is just, gone awry. It's just firing off. So we've got to take away those triggers. So taking away that inflammatory foods and healing the gut is really, really big. It's huge, and really nutritious food and nutrient-dense diet. So really good organic proteins, lots of great organic vegetables, good fats, some carbohydrates, maybe low grain, but really, sometimes nightshades have to go, legumes that can be inflammatory. So it's a bit of an individualistic approach of what they're inflaming, but gut health is definitely, step one. And then looking at, again, referring back to the autoimmune paleo protocol, the diet being 1/4, the other 3/4 are stress management, sleep, and the right movement for you. So that's kind of the approach I sort of take, is definitely we've got to get that gut right. We've got to get your diet right. We've got to heal your gut. Next thing is, what's going on in your life? Are you happy? Are you stressed? We need to bring in ways to manage that stress or remove the stress. If they're not sleeping, they have to sleep. That's where we regenerate. So it's where we allow everything to settle down and rest and regenerate. They're not sleeping, they're not going to get that. And you just can't heal that way. And then movement. So particularly for women, autoimmunity often comes, and particularly thyroid autoimmunity comes with weight gain, weight struggles, and they're usually, doing lots of cardio or HIIT that can be, more inflammatory, driving up cortisol. So we want to get them into really nice movement is essential, but it's restorative. So it's walking, swimming, yoga, Pilates, something that, suits where they're at in their life. For menopausal women, some gentle weights, daily sort of weights or weekly weights. That's the sort of approach I take. So it's a bit of a 4th step, is looking at all those areas, but overall, it's diet and lifestyle. That's how people with an autoimmune condition get into remission if possible, and keep them there as much as possible as well.
So are there any kind of herbs or nutrients you use to get a therapeutic outcome while they're making those changes?
Yeah, definitely. So you can see I'm a bit of a
yes, I love see beautiful herbs in the background.
So my favourites would be for immune modulation for both Graves and Hashimoto's would be Rhamania, Cordyceps, Hemidesmus is another one. Echinacea, I love there as well. Nigella is good. Nigella is more specifically, the research is around for Hashimoto's and hypothyroidism, but it's definitely one I bring in with my Graves when they're in that remission, when the thyroid hormones are settled down. So if I've got them all, they're probably my sort of top 5 herbs for autoimmune modulation. And then looking at their vitamin D stores, selenium, zinc, myo-inositol is a great one for immune modulation. So there's studies around selenium and myo-inositol for reducing thyroid antibodies. Immune modulation of our mushrooms is great as well. But yeah, a lot of our immune-based nutrients, we bring in at high doses. And I feel like I do come in with quite high doses of nutrients because, it needs a lot of support. And we think about the thyroid gland being very nutrient dependent and the immune system being very nutrient dependent. And when it is in an autoimmune state, it's just firing and it's burning through a lot of our, zinc and selenium and antioxidants. So bringing in all of those really good immune supportive nutrients can help sort of support both systems because it's almost depleted. I do see, interestingly, in thyroid autoimmunity, these patients have got the autoimmune side happening, but they don't often get sick. But when they really get into a chronic state, they've got both systems down. Their immune system, that seesaw is just broken. So they do need a lot of nutritional and herbal support to help immune modulation. But you've got to find, I always look at those 3 overlapping circles for autoimmunity. You've got the genetics at the top. Then you've got, endogenous and exogenous factors. You've got being a female you're more predisposed because of our hormones to both thyroid autoimmunity and autoimmune conditions in general. You've got toxins, stress. You've got poor gut health. You've got, all of these things that overlap and will be unique to each person. So it's finding their unique drivers of why their immune system is making, in this case, thyroid antibodies, whether it's a TRAB, whether it's a TPO, a thyroglobulin, and working on those drivers and triggers for that person is, it's really important.
And before we leave prescriptions, what's your stance on iodine prescribing?
My stance on iodine prescribing, and I've looked and researched and studied and used many different types, all of the sort of theories. And I'm one, my sort of stance is that we can't make thyroid hormones without iodine. Okay, so T4 is 4 molecules of iodine, T3 is 3. We also need iodine in the breast tissue. We also need it in the salivary glands. We need it in the mucous membranes in our reproductive organs as well. So particularly for women, it's a highly essential nutrient. So my view is I test. So maybe in the initial stages, particularly with Hashimoto's, and I'm seeing very low T4, I will test urinary iodine, either loading or urinary, depending on, I think, loading if they're not on taking thyroxine, urinary if they are on thyroxine or they're pregnant. And if I'm seeing very, very deficient and needing to supplement, but they have very high antibodies, I'll be looking at sort of how they're presenting. If they're presenting very, very inflamed, very reactive, I'll be working to sort of bring some, modulation, decreasing the inflammation and oxidative stress first before bringing in iodine. And I come in at very low, slow doses to see what happens. Because we can see rises in TSH, we can see rises in TPO antibodies initially. But if they need it, I'm going to give it. But I'm going to be under that 100 micrograms. I'm usually coming in around the 300 micrograms, but in very high antibodies, I will be going, low and slow, building up until I get to that sort of 150, 200, mark. If they're pregnant, I'm going to be bringing it in if they've got antibodies or not, because they need it. Iodine is such an important nutrient for that developing fetus. And we can see congenital hypothyroidism. We can see, growth retardation, brain mental retardation if a mother is deficient in iodine. Graves' disease is a whole other sort of theory where I have seen many cases of iodine. And I think all the research around iodine, just before I go there, is it's excess. And that makes sense to me. If you're putting in a lot of iodine into very susceptible people, it can cause a big flare of their autoimmune condition. I'm using very, very moderate doses here. I'm under that sort of 1 gram dose. I'm not using really above that. In Graves' patients, I feel like iodine can definitely be a trigger in sensitive Graves' patients. And it's like adding fuel to the fire, right? They're already overproducing thyroid hormones. Now, give a substrate to help that, you're just going to increase it. And many of my Graves' patients will say, oh, yeah, I took a certain hair, skin, nails formula, and that has really high iodine. I see that quite a lot. That maybe it's not the only contributing factor, but it could be a factor. So with Graves', I'll make sure their antibodies are down, their thyroid hormones are normalized, and they're pretty much in remission, feeling a lot better. Then I'll test their iodine. And again, I'm going in probably even lower and slower. But I think a lot of my Graves' patients need iodine, again, because they've been making overproducing thyroid hormones. So they're going to be quite depleted at the end of that flare-up or that acute stage. So that's my kind of approach. I think it's essential. And at some stage, most of my thyroid patients will go on it, but I'm using pretty low incremental doses and building up and, not giving excess doses. I see it as an essential nutrient, particularly in women.
Dr. Ameeta Gajjar says every patient who has had COVID must have their thyroid screened.
I think it's important to, again, anyone who has a thyroid condition, we monitor closely anyway. And I think if someone's had COVID or what could be a COVID-like illness, I think monitoring of thyroid function is important to make sure their levels are optimized and, any other interventions can be brought in as well. What I found interesting was also how when they've done studies in the hospitals, in ill patients with COVID, that their free T3 levels have been lower. And there's actually studies going on about using thyroid hormone T3 for the respiratory symptoms in COVID as well. So some quite interesting phase 2 trials happening at the moment. So, but in quite a few studies from around the world, Italy, India, UK as well, they found that people who were admitted with COVID, in some of these studies had low levels of thyroid hormones. Again, it's what came first.
Is there any way that people can prevent thyroid dysfunction post-COVID? I
think definitely the lifestyle. So, let's just say anyone who gets any viral illness like COVID, I think just addressing those factors that we can all do, like sleep and just managing our stress, even if people aren't aware of diets or anything like that, I mean, I think that will still go a long way. And certainly if there's ongoing symptoms and if someone has had thyroid issues before or currently is already treated, also just to make sure they're monitored more closely. You might even have to be monthly just to see, do they need more support?
Bianca says it's important for women to understand how the oral contraceptive pill and everyday viruses can affect their health.
I was actually really thankful. I was reading the Lara Bryden book, the period manual, that actually kind of got me to come off the pill to just for myself, just because I wanted to see how my body would handle not being on a pill and if it was masking anything. And it's funny, a year later, or less than a year, I find out that I have hypothyroidism, which was even just subclinical, that I was on the verge of getting that. So I was really thankful that I did come off the pill for it to, I guess, even just come out. And even though my mum does have it, I think, that's obviously that has to play into it a bit. But even with COVID and understanding how that could affect my body and your cycle, and I think that's just been the most eye-opening thing of really using your period as a report card. And if I had got my period consistently in that time, I don't think I would have gone to the doctors, and I don't think I would have got a blood test and realized, that my levels were maybe not where they were meant to be. So I think that was, I think it was, kind of all of those factors that kind of came into play, and which I'm thankful that it did happen, so then I can get on top of it now before, as a subclinical, before it, I guess, is too late. And maybe that's where I think my mum even found out later, because really she came off the pill and then went straight into having kids. So didn't really, I guess, have that time where I guess I'm having that time to find out if there is any issues and trying to fix those if I can.
And how are you feeling now?
I am feeling so much better. Definitely my mood. I think that was the biggest thing. Like even just getting in a depressed kind of, or like not really knowing what was going on. That was really being really down. It's really hard to get out of that. I think like when your body's not doing something that it's really meant to do, and you don't understand what's going on, and you're having all these symptoms, and you just, there's that confusion about what is going on. I was worried that I wouldn't, or doctors wouldn't even be able to figure out what was going on. Like I was worried that this isn't good. And it was quite scary as a patient. But now I feel so thankful that I've been guided the right way and had the help I've needed, and has given me the right medication, and I've had the right support from like my naturopath as well, and that have kind of helped me establish all the things that I can do to improve and to help my thyroid. So it's been I feel a million times better, which is amazing.
In the next episode of Between Clinical Minds, we continue the conversation, this time on thyroid cancer and cellular hypothyroidism, with naturopath Melissa Briggs and holistic dietitian Natalie K. Douglas. Thank you for listening. We hope this podcast engaged and empowered you. And thank you to all of our experts. You can read more information on each of them on our website, bioconceptsengage.com.au. If you enjoyed this episode of Between Clinical Minds, please refer a friend and share the love. To continue the conversation, you can contact us at bioconceptsengage.com.au, where community is more than a concept.